So every time I come in, there's like a therapy schedule, and you've had up to 4 different things on there: OT, PT, ST, RT. So what are all the therapies that you've done? What did you like, didn't like? What do you think it's actually, where have you seen the most improvement?
Well, so ST is speech therapy, and as I said earlier, I've graduated so much now. I'm capped to actually have my voice back, and that was really cool because there was a speech therapist downstairs on the 16th floor, and she was one of the ones that realized that I actually did have a voice. Now, I want to remind people that we were told that I have or had, I don't know, a vocal cord damage. And they weren't sure, in the DR, they weren't sure if I'd be able to speak. That's kind of what they were, you know, saying.
Working under the assumption that
Yeah.
you'd never have a voice again?
Yeah.
Oof.
So and what's interesting about the DR is that they kind of assumed the worst. They were not doctors or nurses or anybody that, well, the nurses never really commented, but the doctors there, they always assumed the worst, and they shared that with you, the worst. So it was a bit overwhelming at times.
They probably see a lot down there. So.
I'm sure they do. And because they don't have rehab, they end up with the worst, right?
They have no rehab in the DR.
Oh, little.
Wow.
There were a couple of physical therapists. There was no speech therapy, no occupational therapy, no respiratory therapy.
I'm so glad you're here.
I know, right? And that's basically what the doctor said in the DR in the end, was that we've done everything we can medically. We don't have the resources that she needs. She needs rehab. You need to take her to the U.S. because the U.S. has the best rehab opportunities and availability. So.
And he told you that while Michelle was down there.
Yes, Michelle, our cousin, Jeff's cousin.
She's been running the GoFundMe for anybody that's following the GoFundMe. That's Michelle.
Michelle Linkous, yeah. Yeah, she's been amazing as well. Helped us a lot, especially when she went down to the DR that week.
She is an advocate for you.
She is.
And she's a tougher cookie than I am.
Oh, man, she really is. Sometimes she doesn't think so, but she's a fighter, I'll tell you what. She pushes, that's for sure. She pushed Jeff a lot. She pushed him hard. So, and it was just on different things. I mean, Jeff's been amazing, but she was really awesome. She was pretty much who Jeff was leaning on during the beginning and everything.
Good, I'm glad he
So,
had that.
I know, me too. I was so grateful for her because I didn't realize that he was, talking to her or leaning on her as hard as he really was. So, but she stepped in.
So where have you seen the improvements?
Oh.
And you talked about speech therapy.
Oh, right. Sorry, I got distracted.
Sorry.
You got on Michelle's subject, so.
I'm so sorry.
Yeah. All right, so the therapies, obviously speech therapy has been awesome. I've graduated from even going to speech therapy any longer. But I have to give credit to respiratory therapy. As difficult as respiratory therapy was.
I'd come in and you were like tilted all backward,
Yes.
like on your head practically.
Upside down, backwards. Gosh, I wish I could remember the name of the position or what they called that treatment. I don't remember.
And then he would like manually cough, like
Oh
pressing
yeah,
on your
it's
chest.
called
and-
cough assist, and he'd be like, take a deep breath, and I'd take a deep breath, and he'd like just hold, it was basically his hand over the top of my rib cage and press down and then like shake it, and that helped me basically cough stronger, cough harder, and get some of the secretions up so that he could then suction them out.
And there were 2 machines in here at one point.
Oh gosh, there was the green machine, which I absolutely loved, and then they introduced the red machine. And again, I don't remember their names. However, the green machine was great because it forced me to take really deep breaths and open up my lungs. And it just felt so good to take those deep breaths. And I got to the point to where I think I was supposed to be doing 400. Gosh, again, I don't remember the specifics. Anyway, the number was 400. And the few respiratory therapists that tried it, I would give them the evil eye and be like, shaking my head, no, it was too much. It was entirely too hard. It was like overinflating a balloon,
Oh,
you know, and I would be like, I can't, stop it, you know,
you're gonna
take it
burst.
out. Yeah. And so there's one respiratory therapist who became my advocate, I mean, hard. He would read the reports even whenever he wasn't assigned to me. And then I think he started requesting me as a patient so that he could be my respiratory therapist.
Was he the one with the Forrest Gump jokes and stuff?
Yes,
Ah.
the one that rode a little scooter because he had broke his foot.
Oh, okay.
Yeah, same guy. Yeah.
Okay.
Yeah, same guy. But he struggled getting along with others. But I absolutely loved him because he truly was, for me, he was fighting for me. And
You're very protective of him. I noticed that.
well, you know, some of those, and I get it, you know, his personality just clashed with others. But because he was such an advocate for me, I was like, hey, don't be dissing him because he's my bud, right? And he really was. He'd come in and tell jokes like you're talking about, and very knowledgeable. He was always, giving us information that we didn't know or talking about different things. And I had no problems with him. Mostly everyone else did, but
Well, you don't mess with
Yeah.
Crystal's people.
well,
I know that.
yeah. So anyway, back to the red machine. Oh, the one that I didn't care for. That one forced small puffs of air into my lungs, and it was very. Don't mind that noise. It was
Jeff
very.
just walked in.
Yeah. It was very hard on me.
That's the one that was like, like
Yeah.
in your
It,
in and out.
exactly. And they would go fast, and then they would slow it down, and it became really difficult when they slowed it down. But that was also part of the breathing treatment that I can't even explain, but I did not care for that. Now, in the end, that one I didn't mind. It got better and better, and I think it's just because my lungs were getting so much stronger, and my RT buddy, he would tell me, "Oh, I'm so proud of you. You were just doing great." I mean, he was also just a big supporter, right? And he would just, encourage me and just be like, "You have been one of the best patients," and just things like that that made me want to, take deeper breaths and, just okay. He'd be like 5 more minutes, and I'm like, I hate this machine, but okay, I can do 5 more minutes. I've been gritting my teeth the whole time thinking,
But it's because of that you're capped off and you can talk.
exactly. So first I graduated from the breathing machines, both of them. Well, the red one first, they did take that one away, and they were still giving me the green breathing machine treatments. And like I said, I loved those because it was just like taking a breath of fresh air whenever you've been in a room that's just stifling hot or something. It's just, they were really cool. But anyway, those treatments. But anyway, I graduated from breathing, and then that's whenever they decided to change my trach from the cuffed trach. So I had a trach that had like a small balloon in it, and I needed that in order to do the breathing machines. That's the reason why I had the cuffed trach. So once I got off of the breathing treatments and graduated from respiratory therapy, they decided to move me to the cuffless, smaller trach. And when they put that in, it was night and day. I was able to speak without any assistance, without the speaking valve, without anybody having to occlude my trach, which is
Like sticking their finger over it.
right. So I could just talk. And granted, it was a little breathy. I could say a few words per breath, but before I could only say 1 word per breath. Oh, I wanted to go back to that the speech therapist on the 13th floor. That's where we got diverted.
Oh.
She was the one that first started working with me, and after working with me on a Friday, she came back on Monday and she said, "I thought about you all weekend, and I figured out something." She said, "It just kind of popped in my head." She was like, Crystal can whisper, and I can hear her. She has a voice. She's got what we call speech leak. So that means she can say things. So this was even before I came up to rehab. So we were downstairs, and she said, take a deep breath and just say your name. And I was like, no. First she occluded me, and she said, well, you have to take a deep breath before they occlude you. So I took a deep breath, and she occluded me, and she told me to say my name. So I said, Crystal, and it came out. And I was so excited. I was like, yeah, hey, I can speak, right? Even with supposedly damaged vocal cords. And then she said, okay, I'm not going to occlude you. Just take a deep breath and try and say your name. And so I did, and my voice came out. I was able to say my name. And Jeff and I both looked at each other, and we were like, our eyes kind of pancaked open. And we were like, what just happened? And so she was like, I knew it. She goes, yeah. So she was really happy and, not totally surprised, but she was like, most people who can't speak, you can't hear them. They can't whisper because that's speaking.
Yeah.
It's still a matter or a way of speaking, right? So, so that was the first attempt at speaking and hearing my voice and being surprised that I actually had a voice. But, it was just a little bitty tiny voice, right? So, and one word at a time doesn't, for me, doesn't, mean that I could like really talk. It would take forever to say something. Sorry, Michelle keeps kicking the table, bouncing the camera.
I just want to make sure it's doing
it hasn't died on us.
Right.
Yeah. Okay, so that was speech and respiratory. I was still going to occupational therapy. Occupational therapy is the therapy that kind of helps you get back into your home life. They teach you different things, how to feed yourself, how to wash clothes again, cook again, just to kind of get back into your home life.
Teaching you how to cook?
Well, no, because I never got to that point.
Oh.
I can't, stand up in the kitchen and cook. So obviously, if and when I get some more movement in my arms, then I
You can
at
move
least
this arm like at your shoulder.
Yeah, I can bring it up and out and raise it. Right now, I don't have on a splint, so my wrist is still pretty weak. So it's pretty floppy, is what I call it. So
You got some good road rash going there too.
oh yeah,
Or what they call that, DR tattoos?
yeah, Jeff calls them Dominican tattoos. So I got quite a few of those.
I know you get cold.
Yeah, I do. But so that's occupational therapy, and we've actually tried, and I was successful at feeding myself some pudding. So that was kind of cool.
Smack yourself in the face with
I
it.
did not smack myself in the face with it, but I was able to get it up and into my mouth
Good.
and take a few bites, so that's good. So at this point, as long as the food sticks to the spoon or the fork, then I'm okay. I can put those kinds of things in my mouth, but eating peas or anything, loose,
Yeah.
that's not going to work. I'll be wearing that.
Oh, no.
So, and then physical therapy, that's all about stretching and transferring from like the wheelchair to the bed or the bed to the wheelchair, the car to the wheelchair, back and forth. They do a lot of therapy around those types of things. And we did a car transfer today. Getting into the car was fine, not a problem. We used Shelley's nice, pretty car. Getting out of the car was a little more difficult. Jeff nearly smothered me to death. So I was like, yeah, no, we're not going to do that. So we're not ready. We haven't successfully transferred back. So,
Again, sorry.
my hat keeps falling
I just got it
off
today,
my
so
head.
we're trying
Yes,
it out.
it's my new hat. Shelley bought it for me. So that's physical therapy. And Jeff and I can continue doing that at home.
Good.
Which we will.
And he's training
well
on
as
how to
hockey.
do all that.
Oh yeah, yeah. He's got a lot of training, so that's good. All right. Next question.
Okay.